You're listening to Fast Facts Ask the Expert with Machell Hudson-Hoover. All right, welcome back everyone to another episode of Fast Facts Ask the Expert, Oral Systemic Edition. I am joined today by Machell Hudson-Hoover. It is so hard to say that this many times in a row. I'm thinking look, in the next 6 months, I'm going to change the way I say that. But thank you for being here today.
I really want you to say that like 3 times real fast. And you should have guests to say that 3 times. I mean, I could totally not do that, Andrew.
I think we're going to say some bad words by accident if we do that. So, okay, here we go. So we do have some facts for the audience. This is kind of a relatively simple question, but maybe a little bit more of a complex answer. So again, audience, if we are not hearing the answers you want, make sure you're reaching out to Machell later on. But Machell, are you ready for your question?
I am ready for my question. Let's go.
I want to know about xerostomia and how does it raise the risk of systemic disease in the patients that we're seeing?
Oh, this is probably the most simple question I think you've asked me so far, because it is a foundation of what we do when we practice risk factor protocol. And the best way to do it is by utilizing Carrie's risk assessments. And if you're using Carrie's risk assessment, reach out to me because I want to give you shout outs, because that is something that's not utilized nearly enough. What do you think, Andrew?
I agree. Yep.
So when do we typically start seeing xerostomia in our patients? It's typically going to be when they're older, although due to the mental health crisis, the obesity crisis, we're actually seeing younger and younger present with xerostomia. And what happens when we have xerostomia? What is the number one concern that you have? Well, I'll answer that for you. I automatically think pH. We have an acidic pH. What does an acidic pH do to our oral microbiome? It has an awful effect, and I was going to use another word, and I'm not allowed to use that. And so sorry. It just is frustrating because it automatically, when we see that, we know that our patients, it's going to really require a lot of hard work from our patients to be able to maintain not only oral health, but systemic health. So when we have dry mouth, xerostomia, we know that it is going to increase our risk for caries disease. That's really what we were taught in school: dry mouth, caries. But have you ever thought about xerostomia affecting periodontal disease? Well, you should if you're not, and I'm pretty sure most of you are smart enough to know that. Well, what's another red flag for us when we're thinking dry mouth? Well, I automatically am going to go and look at that health history. Actually, before my patient ever presents in my chair, if I have a new patient, that health history is eye-opening for me. I'm going to look, are they taking medications? I can tell you the top 10 most prescribed medications all cause xerostomia, and those are going to be in our diabetes patients, our ADD, ADHD patients, cholesterol, all those metabolic and mental health conditions. And so I'm automatically going to be concerned about periodontal disease, caries disease, and potentially even airway. What about our mouth breathers? And so when we have this acidic environment, we know that it's going to raise the risk for oral disease. Well, we're really smart. We're learning that when we have periodontal disease, caries disease, that we have a 50% greater risk of heart attack and stroke. We have a greater risk for dementia. We have a greater risk for GI effects. So gut dysbiosis, for example, for multiple cancers, even beyond head and neck. And so xerostomia is going to be a major concern and really a red flag for me and my doctors when screening our patients.
Awesome. Thank you so much for everything. If anyone had any questions, how could they reach out to you?
Machell at rdhhealth, or you can reach me at Integrative Dental Coaching. And I do hope you reach out.
Thanks. Thank you for listening to Fast Facts Ask the Expert. If you have a topic you'd like one of our experts to answer, simply email me, Andrew at ataleoftoahygienist.com, and we will get it on the air as soon as possible. Thanks for listening.